So I would begin by knocking on the door, closing the door to provide privacy, washing my hands. Hi, my name is Gabby. I'm going to be your nurse today. Could you verify your name and date of birth, please?
Tuchalski, 9/26/2000.
And are you in any pain right now?
No.
Okay. So today we're going to be doing a cranial nerve assessment. So I'm going to go through all of the 12 cranial nerves. And we're going to just make sure that they're working properly. So I'm going to start with cranial nerve number 1, which is the olfactory nerve. So I'm going to have you close your eyes, and I'm going to have you smell this for me and explain what you smell.
Flowery.
Okay, so she was able to describe the odor, which means that cranial nerve number 1 is working properly. Next, I'm going to do cranial nerve number 2, which is the optic nerve. So I'm going to have you close one eye and read this first phrase.
Olfactory scent.
And then close the other eye and do the same thing.
Olfactory scent.
And then use both eyes and read it one more time.
Olfactory scent.
Okay, so it shows that cranial nerve number 2, the optic nerve, was working because she was able to read with each eye and then both eyes together. Next, I'm going to do cranial nerve number 3, which is the ocular motor nerve. So I'm going to begin by shining a pen light in one of her pupils. Look straight. And then I'm going to do it again. Okay, and I noticed that both the illuminated and the non-illuminated pupils were constricting. Now I'm going to have you look at the picture on the wall. And then I'm going to have you look at this Easter basket. And now I'm going to bring my pen light towards your nose. Okay, so as she was looking near at the Easter basket, her pupils were constricting. As she was looking far at the poster thing, her pupils were dilating. And as I was moving the pen light towards her nose, her pupils were converging. Next, I'm going to do optic nerve number 4, which is the trochlear nerve. And for that, I'm going to hold the pen light about 1 foot away, and I'm going to move it in different spots.
Am I supposed to follow?
Yeah, you're supposed to follow it with your eyes. Okay, so both eyes were able to follow the pen light, which means that cranial nerve number 4 is working properly. Next, I'm going to do cranial nerve number 5, which is the trigeminal nerve. So I'm going to have you look upwards, and I'm going to touch the inside of your sclera. Okay, and because she blinked, that means that her trigeminal nerve was working. Next, I'm going to look at the light sensation. So I'm going to have you close your eyes and tell me when you feel the cotton touching your face.
Feel it. Feel it. Feel it. Feel it.
Okay, and then we're going to do deep sensation. So I'm going to have you identify 2 different things with your eyes closed. So if you could touch up and tell me what you feel.
A cup.
Is
Starbucks.
it warm or cold?
Cold.
Okay. And then with your other hand, I'm going to have you touch another thing and tell me if that's warm or cold.
Oh, it's chilly.
Okay. So she had a positive corneal reflex, and she was able to distinguish between the chilly and the cold. And so that means she responded to the light and deep sensations. Next, I'm going to do cranial nerve number 6, which is the adductors. So I'm going to put the pen light an inch away from your face, and I'm going to test your 6 cardinals.
Do I have to follow the light?
Yeah, you're going to follow the light with your eyes. So okay, so both eyes were able to move in coordination with the light, which also means that this cranial nerve was working properly. Next, I'm going to test cranial nerve number 7, which is your facial nerve. So could you smile for me? Could you raise your eyebrows? Okay, and you frown. And then can you close your eyes and squeeze them tightly? Okay, so she was able to perform facial expressions without difficulty. And then I'm going to have you close your eyes. And I'm going to have you taste two different things. So we're going to dip your finger in there. And tell me what you taste. You're going to put it on the side of your tongue. Tell me what you taste. If it's salty, sweet, spicy.
Sweet.
Okay, and then we're going to do it with your other hand. And the same thing.
Salty.
Okay, so that means that she was able to distinguish between the various tastes. So now we're going to do cranial nerve number 8, which is the vestibulocochlear nerve. So I'm going to have you cover one ear, and I'm going to put a ticking watch in the other side.
Mm-hmm.
So tell me if you hear the ticking.
Yes.
Do you hear it in one ear or both?
Both.
Okay, now I'm going to have you cover the other ear. And we're going to do it in this one as well. Okay.
Both.
Okay. And then I'm going to have you stand up. And I'm going to have you walk a couple steps. And then I'm going to have you turn around and go sit back down. So she was able to walk in an upright position and maintain balance the entire time, which means that cranial nerve number 8 was working properly. Next, I'm going to do cranial nerve number 9, which is the glossopharyngeal. So I'm going to have you open your mouth. And I'm going to have you say, ah, and then I'm also going to have you yawn.
Can someone yawn on impact? Okay. I don't know how to yawn on impact.
Okay, so when I was doing that, I was looking for the upward movement in your soft palate, and I saw it.
Yawn.
Okay, and now I'm going to have you swallow. Okay, and you swallowed without difficulty, so that's good.
Mm-hmm.
Okay, so now I'm going to do cranial nerve number 10, which is your vagus nerve. So I'm going to have you say the word hello for me.
Hello.
And then I'm going to have you swallow again. Okay, so she was able to speak audibly without hoarseness in her voice. And she was also able to swallow without difficulty. So that was correct for what she needed. Next, I'm going to do cranial nerve number 11, which is the accessory nerve. So I'm going to put both my hands on your shoulders, and I'm going to have you shrug up.
Oh.
And then I'm going to put my hands on your head, and I'm going to have you turn your head to the left and then to the right. Okay, so because she was able to shrug her shoulders and turn her head from left to right with resistance, that means that her accessory nerve was working properly. I'm going to do the last cranial nerve, which is number 12, and that is the hypoglossal. So I'm going to have you stick out your tongue, and I'm going to have you move it side to side. Okay, so you can put your tongue back. Because she was able to move her tongue in different directions without difficulty, that means her hypoglossal nerve was also working correctly. So because everything was working properly, she had a perfect assessment.